Good afternoon, Long Beach. Today is our briefing for June 10th, 2020. And want to just begin, of course, by reminding folks that we will have a Spanish recap of this community briefing and press conference after the questions, and that'll be done by Alice Castellanos from the Long Beach Health Department, and Kelly Colopy, who is our Director of Health and Human Services, will also be making some remarks and answering any questions. And then, of course, we have Paola right behind here, who's doing our ASL translation, who always does a great job. So thank you all. I want to start off with several important updates, and we're going to talk a lot about COVID as it relates to what's opening next and how we're going to manage moving forward. Just overall, we've had a total of about 2,400 residents who have tested positive for COVID in totality. About 1,700 of them have recovered, and so we continue, of course, to see that most folks that get COVID do recover, and we're thankful for that. But we have lost 103 Long Beach residents to COVID-19. 80 of those 103 have been associated with long-term care facilities. And I think it's important, oftentimes we'll read or see folks kind of minimize the seriousness of COVID-19. And I think anytime you lose 103 of our residents and neighbors, especially many that are most in our vulnerable community, that's something that's a serious issue that we should just take seriously and have honest conversations about as we move forward. A couple announcements and then into some of the reopening news. First is I talked maybe a week or two ago about proposing a new tenant assistance fund. We know that during COVID-19, there are a lot of renters especially that are struggling with being able to pay the rent on a monthly basis, and that unemployment or COVID-19 has made that even more difficult. So last night, the council approved a proposal that we've all been working on, including Councilman Al Austin, who I want to thank for leading efforts at the council level, that is going to pay up to $3,000 per month for 3 months that will support renters and tenants for those that qualify in the city that are low income or that are suffering economic hardship because of COVID-19. So if you've been affected by a layoff or a furlough since this pandemic began, you will be eligible for this assistance. There is an application process and a lottery type system for these funds. That period where you can apply to receive the $1,000 a month for 3 months begins on June 22nd. And we'll have more information at longbeach.gov in the days ahead as to how you can apply for those resources. But if you go to longbeach.gov/LBDS, that's where the application period will open on June 22nd. And that's longbeach.gov/LBDS, and that stands for Long Beach Development Services. That's going to be an important assistance, so we look forward to getting that direct help to renters that are struggling in the city. I want to also just note that we've also extended and provided more relief for street sweeping citations. I've talked about how street sweeping has been difficult for a lot of folks because of COVID and the restrictions around the Safer at Home order. As we're all aware, we resumed street sweeping a couple of weeks ago because of health and safety reasons to ensure that streets are clean. But we also made sure that if someone received a citation, that you could submit that citation to the city and that we would essentially cancel that ticket and that we would waive that citation so that you had that support if you were not able to move your car for whatever reason. We have extended that kind of citation hardship exemption program. Initially, it was ending, but we're extended it through July 5th. And so if you continue to receive a citation as it relates to street sweeping and it's COVID related and you couldn't move your car or there was an issue, we understand, reach out to the city. And on the back of your citation, there's an email, which is longbeach.gov/parking/citations. It's right on the back. If you get one, send an email, and we're working to waive those tickets so that we get you that relief. This entire time that we've been battling with COVID, it's been our mission to try to provide economic support, whether it's been not shutting people's water or gas off, giving people relief through lowering or eliminating fines, and also dismissing street sweeping tickets. So we're happy to do that, and we'll continue to do that. So please take advantage of that if you need assistance. And I want to also now talk a little bit about what's next as far as the economy. We know that that up until now, Long Beach has been working closely with the state and our regional partners on opening up a series of businesses as our hospitalization rate, our preparedness in our hospitals, and as our data kind of have mapped out kind of where we've been. We know that a lot of our indicators are been going in the right direction. We still have concern in some areas, especially as it relates to hospitalizations. But we also know that we have plenty of room in our hospitals, and we have plenty of ventilators, and we have the ability to take more if there ends up being a surge of need in our hospitals. We know we have that capacity, which we're thankful for. But we really also want people to be safe. Now, on a few days ago, we know that Governor Newsom announced a series of new sectors that would be allowed to reopen with modifications as early as this Friday, which is June the 12th. And here in Long Beach, we are going to be amending our local safer at home order. And we're going to be aligning essentially with our regional partners, all 88 cities in Los Angeles County. And we get asked a lot, why is alignment important, and what happens in Orange County? And as a reminder, so Long Beach does not exist in a bubble. We know that a majority of people that live in Long Beach work outside Long Beach. We know that a lot of folks that work in other cities are also coming into the city and vice versa. And so we have a very much what happens in LA affects Long Beach, what happens in Orange County affects Long Beach, and what happens in Long Beach affects those other areas. And so if we don't move as a region, it becomes problematic for us. We will be affected regardless of where the city goes. So our own health officer, Dr. Davis, and the LA County health officer have reviewed our local data and have determined jointly, per state issued guidance, that we can start opening some additional sectors and move to stage 3. Now, these adjustments are based on data and science, and our health director will go to some of those details. But I want to share what Long Beach will be able to begin reopening starting this Friday, and what we're not going to be able to reopen, because not everything that the governor said is allowed to open will reopen, because our health officials, in talking with the county and the state, don't believe certain sectors are ready, and I'll explain that. So what will open beginning this Friday of new types of businesses? And by the way, these can't just reopen. They have to reopen with restrictions and with some very strict guidelines as to how they reopen, how they're cleaned, wearing face coverings, making sure that there's physical distancing. So all that's in place. Is not just a complete reopening. So first, gyms, fitness centers, and swimming pools will begin to reopen this weekend if they would like. Of course, it's up to the business. And there are some serious kind of modifications as to how they reopen. Day camps for youth will be allowed to reopen, which we know is important for the summer, especially. Campgrounds and outdoor recreation, including beach parking lots, will begin to reopen. We do have some, of course, campground opportunity in Long Beach and certainly across the county. Our own aquarium of the Pacific and our museums and galleries in Long Beach can also begin to reopen this weekend. And that includes, we have a couple dozen gallery spaces across the city that really have been thoughtful. I actually met with many of these gallery owners a couple of weeks ago. They're very thoughtful about how they're going to reopen and kind of keep distancing in place. Same goes for the Museum of Latin American Art and our Long Beach Art Museum. Have really put a lot of thought into how they reopen safely. And hotels, our hotels in Long Beach, including short-term rentals, will begin accepting leisure travel beginning this weekend. We know Long Beach is a city that depends largely on tourism. I've talked to a lot of workers and housekeepers and others that want to get back to work, but want to do it in a way that is safe. And so we know that the hotels have been working really hard with our partners at the Convention and Visitors Bureau to reopen safely, and will begin doing so this weekend. And then Long Beach also has significant film production, TV production that will also be allowed to resume as this weekend begins. And that constitutes a lot of what can open. However, I know that there's been an expectation about some other industries, and I just want to be honest. Not one of the 88 cities in LA County, including Long Beach or Los Angeles or any of the others, believe that we're ready to reopen bars. And I know that's hard for some folks, especially for a lot of bartenders and folks that work in this industry. But bars will not be reopening. I think the county health department, our own health department, our state partners don't believe that our numbers are adequately there yet to move to reopening bars. And they're not adequately there to reopen any sort of family entertainment sector. And family entertainment consists of bowling alleys, arcades, and other types of kind of family entertainment locations where there's a lot of interaction between guests. And so those will not be reopening as of this Friday, even though they might reopen in other parts of the state where the numbers, by the way, are better than where there are here in Long Beach or in the county. We know a lot of folks are disappointed, but we are making these decisions based on public health, and these are the decisions that are being made by our health department and Dr. Davis and our team. Separate of those, which are those two are allowed by the state, there's a series of other industries that are still not reopening anywhere in the state of California, and that they're still closed. And even if you got a fast-track variance, you still can't reopen. And I just want to be very clear because I know there's a lot of questions. So what's still closed? Nail salons, tattoo shops, spas and massage, bars. We talked about, and of course, if a bar serves food and has a full menu, there are some opportunities to reopen. And if it's a bar with food, we've announced that before. Movie theaters are still closed. Live performances, whether it's the symphony or theater, entertainment centers, concerts, stadiums and arenas, and larger theme parks and festivals and large gatherings of big events are still not allowed by the state of California. And so I think those are all important. It's really important now because this is a shift in the economic output of our community. We have to be more careful than we've ever been. That means we've got to practice physical distancing. We have to use a face covering. When you're out, please, it's so easy to just put a face covering on. When you won't be allowed in any of these places without one. And if you are, then that business is not following the rules. You need to wear a face covering when you're out at a retail store or at a location. We understand that, if you're eating at a restaurant, there are some modifications that have to be made. But you should go out with a face covering, and people at these businesses should be wearing face coverings as well. Hand washing, continue, and continuing disinfecting high-touch surfaces. With each step forward, we're going to continue to evaluate our at-risk populations, the amount of PPE we have, which is still significant, so we feel good about where we are. I'll be very honest, we see that as more is opening, the impact of the state of California is becoming larger. But Long Beach is prepared. I feel, and the health department feels confident that we are at a good place with our hospitals. We've checked in with all of them, but we will monitor that. And if we hear from our hospital leadership that they're getting concerned about where we're at with the amount of folks in hospitals, if they are sick or they are in critical condition, then we're going to have a different conversation about stopping or moving backwards even, which we do not want to do. So with that, I want to just encourage people to please stay safe. This is an unprecedented time that we're dealing with issues of racial justice, and we know that conversation continues. And I know that for many it is exhausting to both experience the time that we're living in, where we're all trying to be better and achieve justice for our entire community, and still fighting this very real disease that is taking lives every single day in our community as well. And then you top that with the economic anxiety and the real loss of jobs and the kind of record unemployment rate that we now have because of COVID-19. This is going to be tough couple of months and year ahead. So let's continue. Let's do the good work. And I want to turn it over to our Director of the Health Department, Kelly Colopy.
Thank you, Mayor. So the City of Long Beach is aligned with the state guidance and also the county orders on our reopening. So the county will also be issuing a new order tomorrow where we will be opening, where they will announce the openings, and they will be along the same lines as the opening that the mayor just discussed. We have tailored our approach. We do look at what the different guidances are and determine whether sometimes we need to make them a little more strict than what the state is to ensure that we can sort of work with our numbers and be able to minimize any additional spread. Our public health remains the top priority, and we have been and continue to make sort of local and regional decisions together in terms of what to open. So we have heard that the couple of things that are not opening that are currently allowed at the state level are the family entertainment centers. We are looking at the ability to open those later in June, where we look at the data and determine what those are. Those kinds of things include movie theaters, bowling alleys, and miniature golf courses. These businesses by nature have a lot of high-touch services, a lot of kids running around, very hard to distance, and they're almost like a playground. So we think we want to make sure that they're sufficiently prepared to create a safer environment for their families. The other that will be not ready to open are bars and wineries. Though we will be reviewing that as well, and that later in June we'll be able to reevaluate. These will likely follow the same guidelines and protocols that we have for dine-in restaurants, but you'll be hearing more about that moving forward. As schools transition to summer break, we know that parents have many questions as what they're going to do for the new year. The Long Beach Unified School District is working with the LA Unified School District to determine the best strategy to reopen this fall. We'll have more information on in-person learning in the weeks to come. Funerals were already allowed under the order, but at a reduced capacity. Weddings are still considered high-risk events. So at this time, wedding celebrations cannot go on until further notice. So we want to just make sure, and the mayor's talked about it, and I think I talk about it just every time that we speak, is that we are slowly reopening, and we're really working to follow the data. And it means that more and more people are out, more and more things are open, and what that means for you is that you have more and more opportunity for which you could become exposed to the virus. So it continues to be safer at home, will always be what we're saying, but we're also balancing the difference with public health as a COVID and public health as an understanding that income is so important to be able to also maintain health, access food, and other things. So we're balancing all of that along the way. But while we are here and while we are in this space, I urge you to be vigilant in making sure that your face coverings are on when you are in groups, that they are on when you are inside with other people, that you're keeping your distance, and that you're following all the safety protocols. It's more important now than ever. It is really even more important is if you are living with someone who is over the age of 65 or has underlying health conditions. Are they more at risk? And while you may be healthy generally, and maybe you get through it very quickly, it's important that if you are out and about and coming home, that you are really paying attention to what the impact could be within your household. We do recommend that that you avoid high-risk exposures as much as possible, and probably the best place to do that is hanging out at your house. In terms of protest and quarantine, I want to just talk a little bit about what we've been thinking about at the city level. As a public health professional, I firmly believe that racism, both individual and structural racism, as well as injustice, is a public health crisis. I've shared this with you along the way. And it is really the fundamental cause of health disparities across our city. I also, as a government official and American citizens and me, strongly support your protection as a First Amendment right to protest. So I support people's protests. However, I want to get clear that large events are very, very high risk for viral transmission. So the likelihood that a person will contract the virus is a numbers game. The more people you are in close contact with, the more likely it is that you'll be infected. Everyone must weigh their own health risks and the health risks posed to those that they live with and determine if attending an in-person protest is the best option for them. If you participated in a protest in the last if you've participated in a protest, then you may consider quarantining yourself for 14 days and then really monitor yourself for symptoms. The ability of public health professionals to conduct contact tracing of individuals who attend large-scale events is extremely limited. And I'm just asking all of you to do your part. If you are with a lot of folks, really be paying attention to what's going on for you, and as much as you can stay home and quarantine is really going to be better for those who are around you. There's also been a lot of questions about asymptomatic transmission of COVID-19. So a lot of people say, it's like, I get tested, I don't have any symptoms, so what do I do with that? And I don't want to get into too much detail, but COVID-19 does spread if you are asymptomatic. And so we want to make sure that, that people are following those quarantine and isolation orders. So if you have tested positive for COVID-19, whether you're symptomatic or not, or you think you might be infected, you must self-isolate in your home for 10 days after your symptoms first appear, and at least 3 days or 72 hours after your fever is gone. If you are asymptomatic and you are tested, you just have to stay that whole time. Whether you feel fine the whole time, you are staying at least 10 days at home. You must also notify close contacts of their exposure, and then in turn, they would be asked to self-quarantine at home and monitor for their symptoms to make sure it doesn't expand. So it takes all of us. So as we are weighing the risks about whether we open different sectors, as we are looking at what is going on and doing our best to support our businesses and our individuals, we really want to make sure that you are aware of the risks and that you are willing, as you take those risks, to understand that you will also need to protect those around you in case you are infected. So I'm open for questions. Or back to the mayor. Thank you.
And I know we're going to take questions, but just one more announcement because I think I was reminded about 4th of July coming up. A couple things. So one is, first, we know that generally fireworks are illegal in Long Beach. I say that because, like many of you, I've been listening to fireworks go off every night in the city, all across the city, regardless of neighborhood. They're going off everywhere. Fireworks are illegal. They are dangerous. They can cause fires, and they certainly can cause serious damage to an individual and it's happened in the past, of course. You can end up seriously injured. At the same time, I want to make sure people know, we've gotten a lot of questions about, why aren't we stopping fireworks? It is not easy to have fireworks go off, have a police officer or someone come to the residence, and by the time that transaction happens, people are gone. Fireworks are extinguished. So it is very hard to catch folks doing fireworks as they happen. But they, of course, we are able to do that on occasion. The police officers are very aware of fireworks, as is the community. A lot of programs on education that's happening. But I just wanted to share kind of the frustration that we all have around fireworks, and I wish people would do the right thing. They are of concern, especially to folks with pets and other people that suffer from PTSD and other issues. We should be respectful of them and their service to our country, and not put out fireworks. Tied into that, we've had questions about block parties and 4th of July events. A lot of us, including myself, like going to Big Bang by the Bay around the 4th. As a reminder, the state has yet not put out clear guidance on these large types of gatherings for 4th of July. So we're asked a lot, well, is the city going to allow to have Big Bang by the Bay? That decision isn't up to the city. That decision is up to the state if they allow those types of gatherings. And if and when they allow us to have those types of events, then we could work with the organizations and the community that wants to have those events. We would love to see opportunity this 4th of July to celebrate with everyone. in a way that's family friendly and that we can enjoy, and a way that's enjoyable in a safe way with the health challenge in front of us. But again, we don't have state guidance yet, so we are unable to move forward and provide people with a clear answer yet. We hope to get that soon, and we think because July 4th is coming up, the state is bound to make an announcement on those types of activities anytime soon. So I just wanted to add that because I think that was an important question. And then we can take any questions. Kelly, I'm sure a lot of these are probably for you, so why don't you come on over.
Thank you, Mayor. The first question is from Valerie from the Long Beach Post. Go ahead, Valerie.
Hey, can you guys hear me?
Yes.
Okay, so this is for Mayor Garcia. Earlier this year, the city made the decision to close the city hall and public meetings to the public, but hasn't allowed for call-in public comment until next week. The city clerk indicated that the decision to move forward with that comes from your office. So my question is, why did it take so long to allow the public to call in for public comment?
Yeah, I think what we've tried to do first is we have worked closely with the city attorney and the governor's office on making sure that we can make our meetings as accessible as possible and do them in a way that's safe. And so that's why we've had the electronic comment in place. And we are following, by the way, the governor's guidelines and what's actually allowed. We've always anticipated that as we move forward, that we would open up more and more public comment and opportunities for the public to engage with the council meetings, which is why live public commenting is starting next week. But we're still challenged with even that happening. And so an example, the live commenting system right now lives in a small room at City Hall where the techs are that operate it. We've got to figure out a way of now moving that system out so that the clerk can physically distance while we're doing the live commenting system, the telephonic commenting system for next week. So it's complicated on the technology side to get it right. And we wanted to make sure we also did it right. We've seen in the last couple of weeks, we were observing what the best way of bringing it back was, some complete technical failures and some huge issues with how other jurisdictions have done live public comments. We've had, I don't want to get into it here, but there has been some pornographic issues. There have been some issues with members of the public doing and saying things that were not able to be turned off and that were not appropriate for a public setting. So we have tried to find the right system, and we instructed the clerk as well as that when we were ready and they felt that they were ready, they can do it safely to bring it back. And the clerk felt that next week that they'd be able to be there. So we're looking forward to having it back next week.
Great. Thank you very much, Mr. Mayor. The next question is from Rachel from ABC7. Go ahead, Rachel.
Hey, so some people are concerned that we're moving too fast in regards to reopening. So why do city officials think our numbers indicate that this is the right move? And do you have any idea like what the threshold is or what criteria would have to be met in order for the city or county, I guess the city in regards to this, to decide to move backwards in regards to reopening?
Kelly?
So we've been following the state measures in terms of attestation, and then they also have sort of a set of monitoring criteria. And if you start to get near those monitoring criteria, then it's a place of concern, and then you would look to at least hold tight where you are. And if that space is not strong enough, then there's the possibility of starting to step back. Our goal is to not have to step back. I think it's very, very difficult to open, to be closed, to open, and then close down again. So we would prefer that's not the steps that we have to take. It really does depend on everybody in our community who's participating with these businesses. So it's the actions that go on at the businesses. Most of the businesses themselves are doing what it takes, the cleaning protocols, the face guidance, like all the different things are being followed. But you also have to make sure that the people who are visiting are following those criteria. So, for instance, when you have restaurants and the restaurants, you need to make sure that your tables are far apart. And if you walk into a restaurant and they're not, please ask that happens, or, that's a maximum of 6 people at a table. So let's make sure that that's actually occurring. So for all the different places, the guidance is in place, and if the guidance are followed and the people who are visiting those establishments are following those guidances, I think we're in pretty good shape. It's when folks are not following the guidance that makes it more difficult. So we are tracking on the indicators that the state is asking us to monitor. And as of last Friday, I shared those data with the mayor and with you all. And at that time, we were under all of those conditions. So we were doing well compared to all those conditions, and we continue to track on that.
Thank you very much, Kelly. The next question is from Haley from the Press Telegram. Go ahead, Haley.
Hi, my question is about bars and family entertainment. Can you speak a little bit more to the specific indicators that you're looking at to potentially reopen those later in June?
I think the key piece is what does the increase look like? So last week we were able to open restaurants and salons, and then we also had approximately 20 protests, and they're continuing. So we are looking at those things, the ones that we've already mentioned that we are opening, and there are some cleaning protocols and others in those spaces that allow for them to be a little bit safer than bars and family centers. So we will continue to track those data. If we really see a large spike in data, we're going to have to hold off. And if we see that we continue to remain in a space where we can handle with our hospitals and ventilators and everything else, then we would look at that and then make that determination around bars and family centers, family recreation centers.
Great. The last question from our media here is from Kelly from the Long Beach Post. Go ahead, Kelly.
Yes, hi. On the issue of nursing homes, the state has mandated mass testing for all nursing homes. I wanted to know where Long Beach is on this testing process and how it's being implemented and funded.
Yeah, so the state mandate for testing of everyone within a nursing home actually lies with the nursing home itself. So it is not it's not required to be the public health function to do that. So we're working closely with our nursing homes to determine their capacity. We did implement a mobile testing unit that is going out to different nursing homes to support their ability to do that. We've also had our public health nurses and others go to do that. We have not covered all the nursing homes. We continue to work through that process. And then some nursing homes have the capacity to do that all on their own, and we are supporting them in that process.
Kelly, while we have you there, like one or two questions from the Facebook audience here is Long Beach considering beaches beyond recreational use only, and what's the plan for that moving forward in the future with parks?
We're looking at our data the same as we are looking at it, for anything else opening. Our beaches have been pretty crowded the last couple weeks. There actually are already a lot of families who are sitting on the beaches while their kids are playing in the water and doing other things. And we encourage you to please continue to do just active play while you're out there. But that is another thing that we'll be looking at in the next couple weeks. We'll be aligning with LA County. It gets very confusing if you're all along the coast and you go from one beach to another and the beach rules change. So we'll be paying attention to that.
Thank you very much.
I think, Jake, is that all the questions? Or
The last question we'll go from the Facebook audience is related to the business licensing. And is the city planning on doing any business licensing refunds or assistance for those businesses that have been closed?
Yes, and I think that is either with just in front of the council or is going to be just in front of the city council. So yes, there's a kind of whole package of economic support for businesses, including refunds, extensions, business licensing. So all of that should be on its way, and hopefully that information will get out to business owners as well.
That's it for the
Thank
questions.
you. Okay, great. So why don't we do our Spanish translation? So thank you.
Gracias, alcalde. Buenas tardes, gracias por estar con nosotros hoy. Queremos empezar con nuestros números. A partir de hoy tenemos a 2,436 residentes que han dado positivo al coronavirus. Aproximadamente 1,785 personas se han recuperado del virus y nos entristece en informar que hemos perdido a 103 personas residentes de Long Beach por el coronavirus. Se han asociado 80 de esas muertes con centros de atención de enfermería a largo plazo. Anoche en la alcaldía votamos para proporcionar al menos 1,000 por mes hasta la temporada de 3 meses en asistencia de alquiler para aquellos que califiquen. Si se ha sido afectado usted personalmente, despedido de un trabajo desde que comenzó esta pandemia, podría ser elegible para esta asistencia y el periodo de solicitud para este programa comenzará el 22 de junio. en longbeach.gov/LBDS. Ahora, unos informes sobre los barridos de calle. Como saben, el programa, el barrido de calle en general es un programa muy importante en nuestra ciudad y entendemos que debido al coronavirus muchas personas están trabajando desde casa o no pueden pagar su multa de estacionamiento. Teniendo esto en cuenta, anoche la alcaldía también votamos para extender el programa de extensión de dificultades del coronavirus, que originalmente terminó la semana pasada, el 5 de junio, pero este programa ahora lo vamos a extender hasta el 5 de julio. So, tenemos otras pocas semanas para extender ese programa y pueda no tenga que pagar esas multas. Ese programa permite a los residentes afectados por el coronavirus renunciar a su multa de barrido de calles, y las instrucciones también están al lado de atrás de la multa que se deja o en la nota que se dejan en sus automóviles. Los negocios adicionales que pueden reabrir. La semana pasada el gobernador Newsom anunció que nuevos sectores pueden reabrir con modificaciones tan pronto como este viernes, pero aquí en Long Beach estamos enmendando en nuestra orden local Más Seguro en Casa para alinearnos con el condado de Los Ángeles. Gracias por su continuo cumplimiento con nuestras órdenes de salud. Me complace anunciar que la ciudad de Long Beach en este momento cumple con los criterios de variación para poder avanzar más rápidamente a través de la etapa 2 y comenzar a entrar a la tercera etapa. Tanto el oficial de salud del condado de Los Ángeles como nuestro propio oficial de salud, la doctora Davis, han recibido los datos epidemiológicos locales y han determinado que podemos comenzar a reabrir ciertos sectores adicionales en la etapa 3. Estos lugares son los siguientes: gimnasios o estudios de ejercicio, incluidos esos con piscina, deportes profesionales pero sin audiencia en vivo, campamentos de día para jóvenes, campamentos de vehículos recreativos y recreación al aire libre, incluidos los estacionamientos de la playa también van a reabrir. Zoológicos, acuarios, galerías, museos, alquileres de corto plazo, también hoteles. Sabemos que nuestra ciudad es muy grande con el turismo, es uno de las empresas que ha sufrido durante el coronavirus. También la producción de música y cine también es permitida. Estamos esperando por lo menos otra semana para rastrear los datos para determinar cuándo abrir los sectores adicionales permitidos por el gobernador en los condados de variación. Aunque las empresas están reabriendo, el coronavirus todavía sí es muy contagioso, todavía está muy presente en nuestra comunidad. La diferencia ahora es que contamos con los recursos y las estrategias para permitirnos reabrir negocios con moderaciones y consideraciones para reducir el riesgo de transmisión. Es importante que todas las empresas sigan estrictos protocolos y guías para la reapertura. Recuerden que estas cosas se han cerrado y la manera para reabrir es solamente cuando están implementando estas nuevas reglas y seguros para prevenir otra ola del virus. También con cada paso que sigamos adelante necesitaremos evaluar al menos unas pocas semanas de datos para garantizar que nuestros hospitales permanezcan estables, nuestras poblaciones en riesgo permanezcan protegidas. Seguimos teniendo una cantidad adecuada de protección para todos las personas, los profesionales médicos. La Long Beach está preparado para enfrentar estos desafíos y así como logramos tener éxito en la etapa número 2, seguiremos igualmente diligentes y cuidadosamente para avanzar en la tercera etapa. Algunos otros datos que nos dio nuestra directora del Departamento de Salud esta tarde, Kelly Colopy, es que la ciudad de Long Beach está alineada con la orientación estatal sobre la reapertura de economía de Long Beach y ha adaptado nuestro enfoque en nuestra comunidad local. La salud de la población sigue siendo la principal prioridad y seguimos considerando las tendencias de datos locales, regionales, para tomar todas nuestras decisiones para reabrir nuestra ciudad. Estamos considerando tentativamente la apertura de los centros de entretenimiento familiar más al final de junio. Esto incluye las salas de cine, de boliche, campos de golf de miniatura, debido a que estas empresas y estos lugares por naturaleza tienen muchas superficies donde las personas no pueden practicar el distanciamiento físico muy bien. Muchas cosas que se tienen que tocar con las manos, o eso siempre pone al riesgo por los gérmenes pasándolos a un lugar o de una persona a otra. Por lo tanto, vamos a esperar a más finales de junio para decidir cuándo vamos a reabrir esos lugares. Los bares y bodegas permanecen cerrados, aunque el Departamento de Salud revisará las tendencias del coronavirus. Es probable que sigan las mismas pautas y protocolos que los restaurantes para cenar. Recuerden que algunos de los bares, si es que venden y sirven comida, sí es posiblemente que estén abiertos, pero si el bar no solamente sirven bebidas, eso significa que no se pueden reabrir en este momento. A medida de las escuelas que están en transición para las vacaciones de verano, sabemos que los papás tienen muchas preguntas mientras que se preparan para el nuevo año escolar también. El Distrito Escolar Unificado de Long Beach está trabajando con el Distrito Escolar Unificado de Los Ángeles para determinar la mejor estrategia para reabrir para este próximo año escolar. Tendremos más información sobre el aprendizaje en persona en las próximas semanas. Por el tanto, los funerales y servicios de fallecimiento sabemos que ya están permitidas a capacidad reducida. Sin embargo, las bodas con celebraciones grandes y muchas personas todavía no son, todavía se consideran eventos de alto riesgo o no son, por este momento no se pueden realizar esos eventos grandes como las bodas y celebraciones con muchas personas. Long Beach no podrá reanudar las celebraciones de bodas hasta un nuevo aviso. Recordarles que tener mucho cuidado, como hemos dicho antes, que podemos reabrir lentamente diversos sectores y actividades comerciales debido al impacto de todos que se quedan más seguros en su casa. Urgimos que aunque estemos reabriendo negocios, empresas y lugares fuera del área de recreación, queremos urgirles a todos ustedes que sigan tomando las medidas y precauciones adecuadas. Mantenga su espacio físico entre ustedes, aquellos con los que no vive, y si use siempre su cobertura facial. Tomar precauciones es muy serio, particularmente importante si usted o alguien con quien vive está de algo riesgo, si tiene enfermedades crónicas o si ustedes viven con personas de mayor edad. Es muy importante porque recuerden que nosotros podemos tener el virus, traerlo a nuestra casa, no necesariamente tener síntomas, pero todavía nos afecta a nuestros familiares y amistades que son de mayor edad. Todavía recomendamos que las personas con altos riesgos eviten exposiciones innecesarias, quedándose en su casa lo más que sea posible. Y con eso también queremos darles poquita información sobre las protestas y la cuarentena. Como profesionales de salud pública, creemos firmemente que el racismo es una condición social que se causa fundamentalmente en salud y enfermedad, y como funcionario del gobierno de nuestra ciudad, apoyamos firmemente la protección de los derechos para que salgan a las calles a protestar, pero sin embargo queremos dejar saberles muy claro que los grandes eventos es en torno a un riesgo muy alto para las transmisiones virales. La probabilidad que una persona contraiga el virus es un juego de números. Cuantas más personas estén en contacto físico cercano, es más probable que se infecte. Todos deben sopesar que sus propios riesgos para la salud y los riesgos para la salud planteadas a las personas con las que viven, y determinar si asistir a una protesta en persona es la mejor opción para ellos. Si ha participado en una protesta o persona en actividad en estas últimas 2 semanas, el riesgo en estos últimos 14 días, es posible que desea considerar la posibilidad de ponerse en cuarentena y controlarse para detectar sus síntomas. La capacidad de los profesionales de salud pública para realizar el seguimiento de contacto de personas que asistieron en grandes eventos como las protestas de la semana pasada es extremadamente limitada, y le pido al público que se haga una parte de ayudarnos a limitar el impacto de transmisión local. Entonces también es un recordatorio. Hemos estado oyendo varios cohetes, o como los conocemos nosotros como cohetes, pero son fuegos artificiales. Recuerden que en la ciudad de Long Beach es ilegal encender los cohetes o los fuegos artificiales, o por favor no participen en esas actividades hay que minimizar el exponer a nuestros agentes de los bomberos, las policías, porque es imposible cuando tenemos una llamada de la operación para que salgan a ver si hay a las personas que están encendiendo esos fuegos. Es imposible contactarlos inmediatamente mientras que lleguen a los hogares. Por favor, nomás queremos acordarles que en este momento, para seguir las órdenes de más seguro en el hogar, que no prendan los fuegos artificiales. Esa es toda la información por hoy. Muy buenas tardes. Gracias por estar con nosotros hoy. Thank you very much for being with us today.